Around 400,000 older people currently live in UK care homes, a figure only likely to increase. Nearly one-fifth of these residents are aged over 85. They all have a complex mix of health and care issues.
I think one of the things we should recognise is that care homes currently provide a lot of support to people with very high levels of dependency, but I think also there is enormous potential there for care homes to not only support the people that currently are resident in them, but if we get the support from health right, we can see them as the centres of excellence for the management of long-term conditions. They can be community facilities, very much the hubs of management around things like dementia. So currently I think the system is only getting a small amount of the potential out of care homes.
One place striving to be such a centre of excellence is Lime Court, a residential care home in Essex. The majority of the residents have some form of cognitive impairment. Since 2010, a sequence of fresh policies and practices have been introduced, all with the aim of reducing hospital admissions. Driving these initiatives is manager Mike Richardson.
When I first came here, we used to have many referrals to our CPNs, etc., for us to have admissions to hospitals. Looking at the numbers that we actually had at the initial stage was too high, far exceeding, and sometimes totally unnecessary. Illnesses and sickness was a primary reason why people were going in, and I think knee-jerk reactions, I would say, when I initially first came here, whilst they were going into hospital. And I think it was a fear factor, I suppose you could say, that this was occurring because people were worried that if they didn't get this professional opinion backing behind them, that, you know, because of always the publicity that comes with negligence and or whatever you may want to call it, actually had effects on the homes.
A key part of Mike's strategy was to give the staff the skills, support and confidence to deal with issues as they arise.
I'm Gordon Snelling. I've been a care assistant here for 3.5 years. And this is Jeannie. She's been here about 2 years, and yeah, we're having lunch. We do lots of training here, from moving and handling, nutritional training, dementia training, fire safety, moving and handling training. The list is endless.
The other key element has been creating better integration with external health agencies. Lime Court now has a community matron, who is the first line of contact to GPs and other medical services. Her role is vital, because care home residents are frailer and more ill than ever before, although she's only one part of the team involved in decisions on hospital admissions.
We managed to get a whole team put together that has allowed us to go for professional advice for us to say yes or no whether someone needed to go to hospital. And by having this multidisciplinary team available at our call, we can now reduce the numbers of the admissions that go into hospital.
Amongst the services Mike calls upon is mental health support. John York is clinical manager of Modern Matrons in North East Essex, specialising in mental health. One of his biggest concerns is unnecessary hospital admissions for people with dementia.
An A&E department for somebody with dementia is probably one of the worst types of environments that you can have. There's lots of people, they're completely unaware of where they are. It's very easy to become disorientated or even be unable to become orientated around where you are. The people, would be noise, there'd be bright lights, there'd be ins and outs and bells and buzzers and alarms, all those sorts of things that a normal person with good cognitive sense would struggle with, would completely overwhelm somebody with dementia. And what happens quite often as a consequence of that is just simply that journey themselves will have a knock-on effect. And if they end up being admitted, quite often just the fact that they've been admitted to hospital, you will see a deterioration in their overall well-being as a result of that. If they're not admitted, if it's an issue that can be sorted out and they returned, again, they might not ever get back to the level that they were. And a lot of that is due to the disruption that's caused by sending them to hospital.
I've seen it in such a state in hospital. People with dementia do rely on what's around them. And the last time she went in, unfortunately, I was on holiday and my sister went. That was her first time to do it. And she said that there was a drunk in the A&E department who was actually physically going to come and hit my mother because she was making a noise. And it nearly ended up they had to wrestle him to the ground. But she was distressed because she didn't understand what was going on.
Keeping residents away from A&E requires vigilance on many fronts, starting with basic issues like infection control.
So what we have is a very robust procedure, starting right from our domestics team right up to ourselves, and that's all being fully trained in infection control practices within the home, but also that we have a monitoring process in it through our domestics, through to our carers, through to our seniors, inclusive of myself, where you actually audit and monitor what we actually do within the home to maintain a high standard to prevent the infection outbreaks within the home.
Falls are another significant reason for A&E admissions.
And what we actually did was a commonality report over a period of time of what times and that our falls actually occur. So what we can do is actually put into place where the staff should be, where the staff are going to operate at that particular time. Also with the intervention of the falls prevention team as well, gives us a clear indication of how to operate with them particular individual. The falls percentage in the home now has decreased dramatically in doing so. And I would say that between 50 to 60% of what we actually had prior to that is now not happening because of this robust procedure that's in place. And it could be very minor factors that can prevent the falls. It could be that someone's on a medication that has an adverse effect to them. So the staff are fully aware that when they actually are working with that particular service user, how to deal with that particular situation.
Administering medication is an important job that is carried out at Lime Court with precision and care.
We check, obviously count every drug round that we do. Everything's biodosed anyway, so we need to check the seal against the mark sheets. So we're very vigilant because it is a very responsible job.
But the ultimate responsibility for getting medication right lies with GPs.
GPs are general practitioners, they're not specialist practitioners. Often they lack the specialist knowledge about mental health drugs, and they will just keep prescribing them because they think they're needed. And with the support of our nurses and access to our consultant psychiatrists, we're able to review the whole thing and reduce the prescription of antipsychotics quite significantly.
One area where care staff can have a major impact on reducing hospital admissions is by carefully observing residents' eating patterns. Weight loss and dehydration are common reasons for visits to A&E.
We were approached as a team structure by the dietetics team and dietitians team of a programme called Food First, which we took on board.
We've been following 12 residents since we started the Food First project in October last year, and they were all taking supplements at this time, and only 4 of them are now on nutritional supplements. The rest are following the Food First programme or not in need of help at all. So it is going well.
What we do know from the evidence is that if people are well nourished, then there is a much lower morbidity and mortality rates. They have a much lower risk of being admitted to hospital, less chance of having to go to see the doctor so much. And if they do go to hospital, the stays are shorter, wound healing's improved. So there are lots of benefits from being well nourished. Malnutrition is one of the biggest things that comes into hospital. Malnutrition on the whole costs the NHS £13 billion a year. So anything we can do to combat malnutrition is a big improvement. I think the project in the care homes is working, and we also need to look at people in their own homes as well.
Care staff regularly monitor residents' weight between visits by the dietetic team. For frailer people unable to get onto weighing machines, there are other methods to check weight.
To measure someone who is unable to get on the scales, you can measure around the top of their arm, which is something called a mid-upper arm circumference. And if it's below 20 centimetres, then their BMI is going to be very low. It's difficult with people who have dementia, but you can always find a way to kind of encourage them to eat, whether it's with finger foods or if they've got a sweet tooth, encouraging those kind of foods to stimulate their appetite.
We use a lot of double cream and butter and cakes and biscuits and puddings and desserts. So we're not necessarily always talking about healthy eating when we're talking about increasing calories and protein.
I think it's fantastic in this care home particularly. They're like the shining star of our project, really.
A further important factor is engaging with residents and their families about all aspects of life, including how people want to end their days. A critical tool in this process is the Preferred Placement of Care Agreement, which allows residents and care workers alike to insist on medical treatment to continue within the home to the very end. At Lime Court, all PPC agreements are developed by community matron Ira Hodges.
The key thing I see is that a lot of advanced dementia patients begin to refuse to eat and drink. They refuse to take their medication, and an inappropriate admission would be to send them in to rehydrate them, because more often than not they are pulling out the drips. It causes them a lot of distress. And my firm belief is that it is the residents, is that this is their only one control they have left in life, and that they are trying to tell us that this is what they want. And it's supporting the relatives and the carers to make sure that they're comfortable and not admitted to hospital and distressed even further.
This is my brother Michael. He's been in here now for about, I think it's nearly 5 weeks. I'm really pleased, having just spoken to him, that it's going to be like palliative care right until the very end, especially with someone who's got dementia. If you was to go into a hospital, understandably, because they're there for other things, they haven't got the time. And you do need time with people like this, and you could only get it in places like this.
What's really good here, you're part of her care planning. You get phoned immediately if there's any cause for concern about health. Everything is dealt with immediately, and you're part of everything in with the people here.
We spend a lot of time with these people. I mean, most of us do 12-hour shifts, so we're here for a long time. You know, we're here generally from the time they get up to the time they go to sleep. So we see their whole day, and we basically help them along with a lot of things in between. Everyone's different, but a lot of people need help.
We've got this whole team that's gelled together now, and they've been with us for the best part of about 14 months now. And by having that team together, what it's actually done is produce the continuity of care and a consistency of care at a very high standard.
Initiatives on diet, falls, hygiene and mental health support have had a clear influence on residents' well-being. Combining these with consistent quality of care means Lime Court has successfully reduced its hospital admissions. But at a national level, there are still issues to be addressed.
There is a lot of talk from policymakers about avoiding hospital admissions, but we must remember that hospital admissions sometimes are appropriate, and what I think we need to see is appropriate hospital admissions rather than inappropriate hospital admissions. And people who are older have as much right to be in an acute setting when they need acute care as anybody else. And it's interesting, we don't talk about inappropriate admissions in children's services, because the expectation is whatever they need they get, and what we need is to move to age neutrality in health and social care, and services should be delivered around need, not around age.